Welcome my colleagues and my dear students. We are speaking about the physiology of shock. Shock is a broad term in medicine and it has many aspects in clinical medicine. Shock is a state of failure of the circulatory functions. As I said at the start of lectures of the cardiovascular system, the main function of the cardiovascular system is to provide tissues with their nutrients including glucose, carbohydrate, vitamin, minerals, and oxygen supply. If this does not occur, we are in a state of shock. So shock is a state of circulatory failure. These are our tissues. This is our heart. If it failed to achieve its role, this is a state of shock. The defect may be in the heart, cardiogenic shock. It may be in the vessels, which are suddenly distended, doubles the values of the normal diameters. We call it low resistance shock. The blood volume may be contracted to a minimal value that is not suitable for transmitting nutrients and oxygen to tissues. We call it hypovolemic shock. So we have three main types of shock. Hypovolemic shock due to contraction of the blood volume, low resistance shock because of a widespread dilatation of the blood vessels, and cardiogenic shock if there is failure of pumping in the cardiac muscle. The manifestations of the hypovolemic shock are to some extent similar to the manifestations of the internal hemorrhage, so that the arterial blood pressure is decreased, pulse is rapid and weak, respiration is rapid and shallow, the skin is pale, cold and cyanotic. We have also intense thirst sensation and the person is irritable. What are the causes of hypovolemic shock? The first cause is blood loss. So the first cause of hypovolemic shock is hemorrhage, and we call it in this condition hemorrhagic shock. However, the person may have a life-threatening hypovolemic shock without blood loss. It may be plasma loss, it may be water loss. Severe plasma loss can occur with extensive powerness. It can occur with state of dehydration. It can occur with severe conditions of gastroenteritis. All these conditions cause life-threatening hypovolemic shock. Low resistance shock is caused by a factor that causes widespread vasodilation. So there is a much drop in the arterial blood pressure and a state of circulatory failure. We have at least three main types of low resistance shock. First, neurogenic shock. Second, anaphylactic shock. Third, the septic shock. Neurogenic shock is because of sudden stimulation of the vasodilator center together with inhibition of the vasoconstrictor center, causing widespread vasodilatation due to exposure to a neurological cause. This may be severe emotion. Severe pain may cause a serious life-threatening neurogenic shock. So you must respect the sense of pain and you must work to abolish it during medical procedures. Otherwise, the patient may die of neurogenic shock. Third, irritation of trigger zones. Some zones like the zone of the larynx, the zone of the epigastrium, and the zone of the testis and other areas. When they are exposed to sudden blows, they may cause severe neurogenic shock. The second type is anaphylactic shock. It is a very serious condition. It may cause immediate death. The person may die within few minutes when he is exposed to a certain allergen. This allergen which causes this severe type of allergy may be a medication or any other cause like stings or bites of certain insects or certain animals. Anaphylaxis is a very rapid allergic reaction that is associated with massive vasodilatation, histamine release, bronchospasm, circulatory failure, and may be associated with death if not immediately treated. The third type is septic shock, or what is called endotoxic shock. Some types of infections include virulent, vigorous organisms that release endotoxins from tissues. Endotoxins cause widespread vasodilation because of formation of too much amounts of nitric oxide, which cause widespread vasodilation and much drop of the arterial blood pressure. Unfortunately, these infections are so serious, and if not treated properly and rapidly, they may cause death. The third type of shock is the cardiogenic shock. It is a state of pumping failure, and this occurs usually because of obstruction of coronaries by thromboembolism. The famous condition, myocardial infarction, is a life-threatening condition because of closure of the coronaries, causing immediate cardiac muscle death and a state of circulatory failure and a state of cardiogenic shock. Management of shock depends on the cause of shock. It is totally different from one type to another, so that when there is septic shock, we need antibiotics. When there is anaphylactic shock, we need adrenaline, and so on. Number two, general measure which can be helpful in most types of shock. First, warming the patient, because all patients of severe shock feel the sense of cold. You have to be cautious and avoid overwarming of the skin, because it may cause vasodilation, which cause further drop of the blood pressure. Second, raising the feet. When you raise the feet, you will increase the venous return to the brain, and this improves circulation and may be beneficial and helpful, and can treat many conditions of simple shock. Third is restoration of adequate levels of tissue perfusion. The most rapid technique is transfusion of body fluids, because fluids are present everywhere. It's better to give the patient saline once shock is diagnosed. Later on, you prepare to do blood transfusion, which is important, especially in hemorrhagic shock. Finally, we give glucocorticoid, which is supportive and beneficial in many types of shock. We reached the end of this interesting lecture. Thank you and goodbye.